Hey, in this video, I'm going to talk about a natural and inexpensive compound that can help regulate your hormones. And that compound is indole 3-carbinol, or I3C, and a metabolite of that compound called diindolylmethane, or DIM, D-I-M. You might see those on product labels. I decided to do a video about this because I'm 32. Most of my friends are around my age, and we're of the age where some of my friends are starting to notice some hormonal changes, meaning the men are seeing things that they maybe weren't expecting. And so I'm having buddies of mine that know that I'm into this kind of stuff come to me and ask me questions. And I'm seeing these things more commonly in supplements now. And so I just wanted to do a little video for people that might be wondering what they are or if they're going to be of any use to them. So again, I3C, I'll just kind of jump into a little bit about this. I'm not going to go deep into the chemistry. I'll give you a little bit of it, but I know if I really start getting into the deep chemistry jargon, then I'm going to lose people. So all of that information is out there if you want to find it. I'm just going to give you sort of high level about what these things are and what they do. So indole 3-carbinol is a glucosinolate. Don't worry, like I said, I'm not going to get too deep in this, but I do want to explain it a little bit. So a glucosinolate is an organic compound that is made up of a glucose and an amino acid. That's not super important, but this is a natural compound. I know these words, big chemical names, sometimes people think of synthetics or that they're man-made. They are not. All of your food, everything organic, all of that stuff is all made of chemicals. So if you hear chemicals, don't worry. It's not something crazy. This is just, the structure of any organic compound. So these glucosinolates are in particularly cruciferous vegetables. That is stuff like broccoli, Brussels sprouts, cauliflower. There's a whole family of these vegetables that contain these glucosinolates, and then glucobrasicins, which is a kind of a step down from the glucosinolate. It's a type of glucosinolate. So these compounds are in these foods, and when you're seeing them in supplement form, what these companies have done have taken these metabolites, these broken down pieces of glucosinolate like indole 3-carbinol, I3C, and then indole 3-carbinol's metabolite, DIM, diindolylmethane, and they have isolated that and put that into a capsule. So why does that matter for you? Well, these compounds do a lot of things in our body, and I'm going to focus on just a few of them. So for men, I will get to this a little bit later, but most guys, when they're using things like I3C and DIM, they are wanting an aromatase inhibitor. I'll talk a bit about what that is. But just more generally, these compounds in the body help regulate hormones, specifically estrogen and testosterone, through a couple of different pathways. Now, we all have estrogen and testosterone in our body. Men have testosterone in higher levels, but we do have estrogen. And I do want to make it very clear that it is important. Men are supposed to have estrogen. You do not want to get rid of all of it. And that's why this is a beneficial supplement if you are trying to maybe limit some estrogen without totally crushing it. If we talk about things like bodybuilders maybe that are taking steroid hormones, exogenous steroid hormones, meaning from outside the body in the form of something like a performance enhancing drug like testosterone or something else, what we think of as steroids, they might take a supplement or a prescription medication that will totally crush estrogen levels, something like letrozole or Arimidex. There's a huge family of drugs that will push estrogen levels way, way down. There's plenty of evidence to suggest that one, it's bad for your brain, it's bad for your heart, but not only that, it actually will limit your strength and muscular gain. So it is important to have estrogen circulating in the body for bone health, even for libido. We think of testosterone level or estrogen levels getting too high, leading to things like a reduced sex drive, but that simply is not true. If you have no estrogen with your testosterone, men will not have a sex drive. So important to have those estrogens, but it is important to have them in a healthy ratio to testosterone. And so in women, what diindolylmethane and indole 3-carbinol is doing is helping regulate their breakdown of estrogens into a healthier metabolite. So estradiol breaks down into two different types of estrogen. I'm not going to go really deep into those, but if you want to look up 2-HE and 16-HE, these are two downstream metabolites of estradiol. For simplicity's sake, we'll think of 16-HE as bad estrogen and 2-HE as good estrogen. It's not that simple, but for our purposes here, that's the way we're going to talk about it. So supplementation with indole 3-carbinol or DIM, or just an increase in your intake of cruciferous vegetables, helps skew that ratio more towards 2-HE, the good estrogen, and away from 16-HE, that bad estrogen. Now, what do I mean by good and bad? Bad estrogen, 16-HE, is more likely to aid to tumorogenesis, meaning the creation of tumors in hormone-dependent cancers. That is what the evidence shows. So in females, there are a lot of cancers that are specifically being grown by estrogen. You think of types of cervical cancer, breast cancer, ovarian cancers that are really, they have to feed on this negative, this kind of bad estrogen metabolite, as well as a host of other things. But you can think of that bad estrogen as kind of feeding those cancers. So if we can help skew that ratio towards a good estrogen and away from a bad estrogen, then that stands to benefit your long-term health, and has been shown. I'm not going to make any claims that you can't back up. I haven't done any of this research on my own, but it has been shown to help regress some symptoms of or signs of oncoming cancers. For example, in clinical trials where indole 3-carbinol was administered to women with something called cervical intraepithelial neoplasia, which is kind of unusual cell growth around the cervix, typically brought on by HPV, the human papillomavirus. Women that were taking indole 3-carbinol and in a placebo-controlled trial, there were about half of the cohort of the women that took I3C had complete regression of cervical intraepithelial neoplasia. So they saw that totally back down. That wasn't 100% across the board. Not all women did, but in some studies, up to 75% of the women that were experiencing this condition had complete regression with administration of something like 400 milligrams of indole 3-carbinol. So that's extremely powerful. That's a great testament to what this compound can do. Interestingly, when women were given just diindolylmethane, just the metabolite of indole 3-carbinol, the same results were not seen. So indole 3-carbinol breaks down into multiple metabolites, diindolylmethane being just one of them. So diindolylmethane does do a bunch of good things on its own, but that study shows that maybe there's some evidence that some of the other metabolites of indole 3-carbinol are beneficial exclusive of diindolylmethane. So if you are interested in maybe these types of hormone-dependent cancers, you're trying to limit that, or this is maybe an adjunct therapy to what you're already doing for some sort of treatment, that study may suggest that indole 3-carbinol would be a better choice than diindolylmethane, in addition to increasing your intake of cruciferous vegetables. Now, other types of cancers and other types of neoplasia that had similar results were vulvar intraepithelial neoplasia, again, a precancerous condition in women. Treatment with I3C showed a reduction in the size of lesions of those women. Not 100% of the women, but some of them did have full regression. Additionally, recurring respiratory papillomatosis, which is another condition that's often associated with human papillomavirus, where people get nodules, kind of like, papillomatosis, really you think of something like a wart, but growths through the trachea, all the way down to the lungs, on vocal cords. This reoccurs in both children and adults that have certain types of HPV, and treatment with I3C was shown to be beneficial for those conditions because those, as the name would suggest, they are recurring. And so one of the most common treatments is surgery to remove those papillomas, but they will come back. So treatment with something like an I3C or a DIM might be beneficial. Again, adjunct therapy to what you are already doing with your doctor. So those are some of those, potential cancer regression or prevention. Just anecdotally, it is shown in observational studies that people that eat higher levels of cruciferous vegetables, again, broccoli, Brussels sprouts, some others, that they tend to have less prevalence of cancer in general. Correlation does not mean causation, but when you give the supporting evidence of what some of these chemicals do, there is good reason to believe that that is a contributing factor. So something to keep in mind. Now, I want to go on to more about what I was talking about initially with aromatase inhibition and, the people that are talking to me about it. How can I optimize my hormone levels without taking steroids? Is there anything natural I can do? And so one of the things that indole-3-carbinol and diindolylmethane are doing are helping to downregulate the production of an enzyme called aromatase. Aromatase is an enzyme that breaks down testosterone and another type of testosterone into estrogen. This naturally takes place in everyone, and people with higher levels of testosterone may have higher levels of aromatase because your body likes to keep testosterone and estrogen in a balance. Now, that can get out of whack. There are some lifestyle factors that can lend itself to increased levels of aromatase, which will mean higher levels of estrogen. And because estrogen for men is just coming from testosterone, when those estrogen levels increase, that also means your testosterone levels have decreased because that estrogen is coming from that testosterone that's been turned into the estrogen. That's not good, obviously, for men. Again, we don't want to crush estrogen levels completely, but for what you think of as typically male things, we need to have healthy levels of testosterone, those not get out of whack. I live at the beach. If you go to the beach now and walk around, see people without a shirt on, young boys, men, you will realize that there is a huge problem with hormone regulation, particularly aromatase in men, because you will see boys and men with pretty developed breast tissue. This starts somewhere around puberty. Guys will have there's a big increase in testosterone, and because they usually environmental factors, they're not very healthy. They have high levels of aromatase too. And so that aromatase turns that the aromatase turns that testosterone into estrogen, which will lead to things like breast tissue growth. Now, when I was 12 years old, I had a condition called of course, it's going to leave me right now. It'll come back to me. When you do have that aromatase, that testosterone increase, and with a little bit of aromatase, you can get little nodules around the nipples that guys will start to feel. They'll feel like a hard spot. This is common around puberty, and then it goes away. That's totally normal. However, when this really gets away from people, that will lead to that stuff like breast tissue. So that's sort of that initial sign that something's going on. If it's not addressed or you aren't taking care of yourself, that will continue to progress. You also see this in gynecomastia is the name of the condition. Again, very, very common, not something to worry about. However, if it continues to progress, it is something that needs to be addressed. And it's something we see a lot in bodybuilders that are using steroids, exogenous hormones, because they do have these super high levels of testosterone coming from outside the body. That meets with that aromatase, increases estrogen levels. That's why you'll see some guys that maybe are, really, really muscular, but they have these really puffy nipples. That is gynecomastia, and that is that starting to progress. So what this indole-3-carbinol and DIM can do is kind of check those aromatase levels. It won't eliminate them completely. We don't want that. We want them to be back at a healthy level, because men are doing things like being inactive, eating a lot of junk food. They're very stressed. Maybe you have hypothyroidism. That's another contributor to high aromatase levels. Lots of things that are now considered common behavior lend themselves to negative impact on your hormones. I'm not going to tell you that you can take a supplement or that you can eat a head of broccoli and still treat yourself like crap and that you won't face these effects. But it's a step in the right direction. And that's why I want to do some stuff like some videos like this, because I want people to realize that there is medicine in your food. I'm a strong believer that almost any condition that people have now can be treated by something that comes out of the ground. And most people have just abused their body so badly with whatever it is, processed foods, inactivity, crazy high stress levels, drugs, alcohol, tobacco, whatever, that they're so out of whack and people are on tons of medication. If you're really far gone, it might take some of that to get back, but there is stuff that you can do naturally to kind of help out. So another way that you might tell, if you compare men now to men 100 years ago, it would be incredibly obvious that there's something very off. But because we see this all the time now, maybe it's harder for people to tell. So I'm going to go through a list of some signs of high estrogen in men. If any of these sound like you, then maybe this is something for you to look into. So increased body fat, particularly around the abdomen and chest. If you got you got a soft chest, you got man boobs, you got a big gut, it's particularly like a soft gut, then you might be dealing with some high estrogen levels. Now, if you have a really distended gut, the kind of beer gut, it's hard. That's something that you definitely need to address. That could definitely be something like insulin insensitivity. You're probably already diabetic or on your way to being diabetic. So if you do have something like that going on, it's something to jump on now. Additionally, low libido and erectile dysfunction. So both of those can be signs of high estrogen levels and low testosterone levels. Infertility, low mood, low energy levels. Signs of depression can often be resolved by correcting your hormone levels. Insomnia, frequent urination, and night sweats. Enlarged prostate, cardiovascular disease. So enlarged prostate, I don't think I have to go super far into what that is, but if you are, aging as we all are, and you're starting to notice more frequent urination, incomplete urination, it might be time to check that out to see if there is something going on with your prostate. And if it is, that could easily be caused by dysregulation in your hormones. So if any of these things sound like you, eat your broccoli. If you want to go a little bit further, maybe you look into some supplementation. But I am always going to advocate by going the natural route first. Again, these are natural compounds, but meaning trying to get these things in your food, because not only if you're eating a lot of broccoli, you're eating a lot of Brussels sprouts, you're eating kale, turnips, all this stuff, cauliflower, not only are you getting the benefits of something like indole 3-carbinol and DIM, you're also getting a lot of fiber and lots of other micronutrients, and you're being satiated by something that's healthy, meaning you'll feel full, and it's things that are good for you. So oftentimes people that are dealing with hormone dysregulation, high levels of estrogen, are typically overweight. And so some of these, adding broccoli where you might have had French fries before is going to be beneficial to that weight loss. And also on top of it, adding fiber to your diet helps regulate estrogen too, because having regular bowel movements helps clear estrogen out of your body that is circulating in your colon. So another little benefit of doing this the natural way. Now, if you want to push it a little bit further, again, there is supplementation out there. With anything, I'm not going to tell you what to do or not. I am not a doctor, but there have been people, and studies show that doses up to 400 milligrams of indole 3-carbinol for 3 to 76 months seem to be healthy. The side effects of like acute high levels of indole 3-carbinol and DIM are what you would expect, something like diarrhea, a little bit of nausea. There is some sign of skin rash in people that take really high levels, and all of this was resolved by just reducing the dose. So if you do decide to supplement, it would be something to go in low at first, and see kind of where you sit. If it makes your stomach feel upset, you start feeling weird side effects, you need to back it off or maybe quit completely, because very, very high levels, mega doses of I3C and indole 3 carbinol seem to have almost a reverse effect. So we're talking a couple of grams a day, thousands of milligrams, seems to start having the inverse effect of starting to have a negative impact on your hormones. So not something you want to go crazy with. If you do want to go the food source route, which again is what I recommend, starting off, the highest levels of indole 3 carbinol, these glucosinolates that you're going to get in food are going to come from Brussels sprouts, garden cress, mustard greens, kale, turnip, cabbage, watercress, broccoli, horseradish, cauliflower, bok choy, in that order. Back the video up here again. I can make a list below. I probably will do that. So those are good places. These are, again, cruciferous vegetables. That's where you're going to get these kinds of these compounds naturally in food. It's also very inexpensive. You can buy it online. Just check your source. Make sure you're getting it from a reputable company that has done some third-party testing to make sure you're not ingesting heavy metals along with your indole 3 carbinol or diindolylmethane. That being said, if you are going to do it the natural route, indole 3 carbinol exists in the cells separated from an enzyme. Now, enzymes break compounds down for our body to be able to access them. So there is a compound in the cells of these cruciferous vegetables called myrosinase or myrosinase. I'm not exactly sure. I've only ever read it. I've never heard anyone talk about it except for me. And those are separate in the cells of these cruciferous vegetables. So when you chew them, those compounds come together, and then they will start to break those glucosinolates down into indole 3 carbinol, which will then break down into diindolylmethane and other things. And, then it starts to have these effects. The caveat there is if you cook these vegetables, that process already starts. It will break down the myrosinase. So they won't combine, but the myrosinase will break down, which means now when you ingest those glucosinolates and you crush into those, you bite into that broccoli, that myrosinase, that enzyme is not there to start breaking that glucosinolate down. And so that has to wait, that glucosinolate waits until it gets way, way, way down in your digestive tract to your colon, where your gut flora, the bacteria in your stomach and your colon, is producing myrosinase. That's up to you to decide, because that will start to, this breakdown will start to take place in an acidic environment, which your stomach is. But that means that you're not going to have the release of this indole 3 carbinol and diindolylmethane until it's in your colon, rather than that process starting once it's in your mouth. There is some reason to believe that it is good to have these raw vegetables intact and eating them where you're getting that breakdown early, and that eating them cooked and having that breakdown in your colon adds some separate benefits, potentially preventing cancers in the colon and rectal area. That's up to you to decide. I will tell you, if you eat a whole head of raw broccoli, you are going to deal with some other issues, like some pretty intense gas, because those carbohydrates and that fiber is going to have to be broken down strictly by your gut bacteria. And that's gonna, what's coming from that. So that's what all the gas in your stomach when you eat like vegetables like that, it's coming because the bacteria is breaking those compounds down, because the hot water or steaming or whatever didn't break it down for them. And so that's up for you to decide how you want to ingest this. Whenever I cook vegetables very lightly. There is a level that you can cook these to do a little bit of breakdown in fiber where it doesn't break down the myrosinase. So just, play with it and see. There are things on the list that I gave that are easy enough to eat raw. You can eat kale, cabbage. A lot of these things would be fine to eat raw. You'd be more comfortable doing it. Whereas if you're like chomping down Brussels sprouts and raw broccoli, it might be a little bit harder on your stomach to digest. So again, up for you to decide if you want to do that the natural route, which I would recommend again. And if you're going to do it naturally, as best you can, try to do these with organic foods. There are something we would refer to kind of like xenoestrogens. that are floating around out there on your conventional, which I hate that name. It's not conventional at all to spray chemicals all over your food. But these conventional foods, being non-organic, are covered in pesticides, herbicides. They're genetically modified. They've been grown with all kinds of fertilizers that don't really enrich the nutrients of the food. They might look like a big, bright green head of lettuce, but a lot of them are essentially nutritionally bankrupt. If that's your only option, it's better than nothing. But some of those chemicals that are on that food are going to lend themselves to poor regulation of hormones. So pesticides, these organic or persistent organic compounds that are used for herbicides, pesticides that are sprayed on your food will lead to those negative effects. So if we're eating conventional non-organic food to try to help regulate, at best, maybe it's a wash. At worst, you're poisoning yourself. So I hope this is helpful. If it can't increase your vegetable intake either way, it can't hurt. But if you are someone that is struggling with maybe some of these symptoms of low testosterone, high estrogen levels, give us a shot, see if it's something that might work for you. Additionally, if you're someone that has HPV, has something like cervical intraepithelial dysplasia, vulvar epithelial dysplasia, a hormone-dependent cancer, talk to your doctor, talk to someone you trust about supplementing with something like diindolylmethane and indole-3-carbinol. Take them some studies to show them, hey, this stuff seems to be working. I want to add this to my therapy. I think this would give me an advantage in treatment, because it will, like some of the stuff I didn't even cover would be, it is proven to help increase apoptosis, which is natural cell death of cells that aren't supposed to be there. Our body is made to clean itself out, clean our cellular garbage out, but through environmental factors, chemicals, things we eat, those processes are not very good in a lot of people now. So we need to get that cell cycle control back in order, and these compounds are something that will do that, help clear out dangerous cells that maybe will mutate and then end up being some sort of cancer. They can stop angiogenesis, which is the blood supply to cancer cells. All of this stuff, there's clinical evidence to prove all of it. So, again, think about it if you're someone that's facing these kinds of things. I'm going to do more stuff like this. I'm going to talk about more natural compounds that are out there that I think could be beneficial to people. And I hope you'll check back in to see what I got going. I know the hormone thing is a big thing for a lot of people right now, and people are trying to get that sorted out. And having regulated hormones benefits a lot of other areas of your life, and maybe will decrease symptoms from some other conditions that you're facing. So I will start to do more videos on stuff like 5-alpha reductase, things like that. So check back in and try to have some good information for you. If you have made it this far into the video, 28 minutes, I appreciate it. And thanks for watching. Talk again soon.